Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentation of anatomy of the inguinal region. In this presentation, I'll try to cover the general idea on the inguinal region and the clinical significance of the features present there, including the hernia of this region, and I'll describe the anatomy of the inguinal hernia. You can see one sketch. This is the sketch of the lower abdomen, and this one is the area that is indicating this one. The arrow is indicating the growing region. This area is anatomically known as inguinal region. Here actually anterior wall and the posterior abdominal wall meets in this region. You can see this figure. This is the median section, and this is a diagram showing that area anterior wall as muscles and posterior wall muscles. You can see this is the anterior wall muscle, and this is the posterior wall muscle comprising of the psoas major, and this one is the iliacus. And you can see this is the anterior wall muscles and the external oblique making this inguinal ligament. Here these two layers meets, and this region is known as inguinal region. You see the posterior wall muscles and anterior wall muscles they are meeting in the inguinal ligament region. This one is the posterior wall and this is anterior wall, both meeting in this groin area. Important thing is that this region has the superficial inguinal ring. This is a gap in the external oblique aponeurosis. So this is one weak point here, and this is the deep inguinal ring area. On the surface we can identify this area. If we see the anterior wall from the back, this is the inner side of the anterior abdominal wall, and you can see the deep inguinal ring here in the fossa transversalis. So this is the deep inguinal region, inguinal ring, and this one is the superficial inguinal ring. It is in the external oblique aponeurosis, and this one is the opening in the fossa transversalis. That is, the gap continues as a canal. This is actually the canal that transmits the vas deferens in the male. This yellow color tube is the vas deferens, along with some structures I will discuss later on in this presentation. And so this is the area in the male that carries the vas deferens, a tube, and it carries it to the outside to enter into the scrotum, to the testis. You can see this is the superficial inguinal ring region. We can feel it. This is situated just, this is pubic tubercle, and it is situated just above and to the medial. So if we place the index finger here in this region, you can feel the position of the superficial ring, and easily you can push the skin inside the canal in the male, because it is well developed in the male. Naturally, this is a weak point here in the lower part of the abdominal wall. This is the spermatic cord that is passing from abdominal cavity to the scrotum, and this cord is mainly formed by the vas deferens and its accompanying structures. You can see this is the inguinal canal. So inguinal canal, already you know the extension and wall formation. So it's an intramuscular passage, we can understand, and it is parallel to and immediately superior to the medial half of the inguinal ligament. This is situated just at the above the inguinal ligament at mid inguinal point, and this is just over the uh, pubic tubercle. So this is the half of the inguinal ligament that is forming the floor of the inguinal canal. Through this, the test is actually developed in the abdomen, and the descends through this inguinal canal to the scrotum. So this is relatively larger passage in the male. And see, this is the descending testis. It passes to the developing scrotum and making this scrotum larger and retaining this canal, because vas deferens has to go inside abdomen from the testis. So it's an oblique passage that is about 4 centimeter long in adult male and extends from the deeper inguinal ring to the superficial inguinal ring, and so it is a very weak point and always pressed by the internal organs, that is intraperitoneal organs, always pressing this lower part because of the gravity pull. So this inguinal canal is meant for the spermatic cord in the male, and in female this is another small structure that is passes through it. This spermatic cord comprises of this vas deferens. You can see the tube. The accompanying artery is the testicular artery, and from the testis the venous return is formed by the plexus, is the pampiniform plexus that ultimately become the testicular vein. In addition to this, some other structures are also accompanying these three to pass through this canal. In female, it is a very small structure. The thin cord-like structure is the round ligament of the uterus. You can see this is the superficial opening of the inguinal canal, and deeper one is at the mid-inguinal point. Its feature varies with the age, and it is well developed in the male and it is narrower in the female than those of the male. In the newborn baby, both the rings are very closer, and if very closer, so the infant they overlap each other. So this is relatively weaker area in the infant, and the canal is very short. Gradually, with the age, it grows and become about 1 centimeter in the infant, and still it is growing further, and the rings separates from each other like this one. So you can imagine the canal become longer. The length increases, so the anterior-posterior wall can collapse and give some protection, valve-like protection to this area. So younger is, this is relatively weaker place than the adult one. You can see this is the canal. So in adulthood, the rings are separated and the anterior and posterior wall is working as the shutter. It can collapse and prevent the passage of the organs through this. This is known as herniation. So this wall presses and it collapses this mid part. So superficial ring here is situated, and if you look behind the this is very weak area, but it is posteriorly supported by this tough structure. It is called the conjoint tendon. You can see in this one is internal oblique muscle, and this one is the transversus abdominis. The two muscles arches over and forming the roof, and then they fuses together to form this conjoint tendon that inserts into the pubic crest, pubic tubercle, pubic symphysis area. So this is a very strong support, posterior support to the superficial inguinal ring. This is oblique fibers. This is internal oblique, and this one is the transversus abdominis fiber. So any structure pressing it from behind cannot enter into the superficial ring directly because of the presence of this one. The relation is also clinically very important. This deep inguinal ring lies lateral to this artery. This is actually accompanied by the vein. Inferior epigastric vessels remain medial to this deep inguinal ring. This is an important relation of this deep inguinal ring, and it is an important clue for the surgeons. The third important structure is this triangular area. This is known as inguinal triangle or Hasselbalch triangle. This is bounded on this inferior inferior boundary is the medial third of inguinal ligament, and this lateral boundary is the inferior epigastric vessels, and medially it is bounded by the lateral margin of the rectus abdominis muscle. It's a very weak, relatively weak place, and it increases, the weakness increases with the age because of the loss of muscular power gradually with the age. Herniation is the abnormal protrusion of the viscera through the weak part of its wall. So in the inguinal region, this is the weak point. So through this, viscera can come to the scrotum, and this is known as inguinal hernia. So this can enter into the deep inguinal ring and can pass through the canal and enter into the scrotum, or this can push the posterior wall to enter into the canal and then passes through the superficial inguinal ring. This both can happen. This is, you can see the deep inguinal ring is intact. Here the deep inguinal ring is occupied by the viscera. You can see the vessels is lying medial. Here the vessels are lateral, so it is passing through the posterior wall. This type of hernia is more common in males than the females. This protrusion can be of two types, so direct and indirect. Already we have discussed that it can enter into the deep inguinal ring and can pass to the scrotum through the superficial inguinal ring, or it can push through the posterior wall of the inguinal canal, enter into the canal, and then pass through the superficial inguinal ring to the scrotum. So both are passing through the superficial, but indirect one is passing through the deep inguinal ring, and direct one pushing the posterior wall directly. So inguinal hernia is about 70% or 75% of the abdominal hernia is this type, and can occur in both sex, but it is more common in male. You can see this is the direct, so vessels are on the lateral side. This is indirect, vessels are on the left side. This is indicating that it is passing through the ring, and this is passing through pushing the posterior wall. But either case, this is passing through the superficial inguinal ring and proceeding towards the. So indirect inguinal hernia, the sac enters the inguinal carriage through deep inguinal ring. This is the feature, and crosses the full length of the inguinal canal, pass through the superficial inguinal ring to be in the scrotum. It have relatively narrow neck, and neck is lying lateral to the inferior epigastric vessels. This is an indication, because with the time, when this area is distorted, it becomes very tough to identify whether it is direct or indirect. But looking at the vessel, you can easily confirm that this is indirect inguinal hernia. It is usually congenital. Congenital means have some birth problem that indicate that causing hernia. This is the position of the artery I am showing, and this is passing through the canal. So this artery is medial to the hernial neck. This is the neck region, a narrow area, and this is the sac region. Already we have discussed that of the inguinal hernia, abdominal hernia, 75 is inguinal hernia, and it is common in male because it is wider. The canal is wider, allow the passage of the spermatic cord. So this is common in male, and in female it is passing a narrow structure. This is known as round ligament of the uterus. More common on right side, it is right testis descends later. You see, when the testis descends, it takes some part of the peritoneum with it. This is processus vaginalis, and this processus vaginalis remain intact in some cases. So possibility of remaining intact on the right side is more because it descends later than the left one. Why it is more common in Finland? Already we have discussed that this internal ring and deep one and the superficial ring are very closer, so this canal is shorter and the area is weak, so it is more common in uh, children as it is less oblique. You can see the two figures already I have shown. So this one is the direct hernial region. You see inferior epigastric vessels are there. This arrow is indicating the deep inguinal ring. So this posterior wall is pushed. So this type of hernia, you see this one is the direct, and you can see this is the indirect because the vessels is there. So this is definitely it is passing through the ring, deep inguinal ring. So feature is the sac bulges directly anteriorly through the posterior wall. So direct is named because it is passing directly into the canal, not passing through the deep inguinal ring. So this bulging, you see this is a narrow passage and the neck is narrow, and this passage will go to this region. So this swelling when the lower abdomen will be relatively smaller, and that will move towards this one, but this is the weak point of the posterior wall. So this will push this area and will make a wider bulging over the lower abdomen inguinal region than the indirect one. So this is the first feature we can see. The neck will be medial to the inferior epigastric vessels. In the other words, we can say the inferior epigastric vessels lies lateral to the neck of this one. So these two are the important features. It occurs in the older age. So if you want to differentiate very early by clinically observing it, if the swelling is small and passing quickly to the scrotum, this is indirect inguinal hernia. And if the surgeon observe during operation, they will find that the inferior epigastric vessels is lateral to the neck, medial to the neck. So this is surgeon will be confirmed, and usually this type of hernia is observed in younger persons, and usually this is congenital because processus vaginalis remain intact. So congenital type of hernia. Now in older age, if the swelling is a bit diffuse and surgeon observed that the epigastric inferior epigastric vessels are lateral to the neck, will confirm that this is direct, and we will observe it usually in the elderly persons. This is acquired form. This is not congenital form. So these four are the main difference between. Thank you very much for remaining in this presentation.